Thank you very much. The Chairman, the Secretary, dear members of Parliamentary Assembly, ladies and gentlemen. On behalf of all Ukrainian Council for Patients' Rights and Safety, let me express my sincere gratitude for giving us a chance to deliver the problems of millions of Ukrainian people to such distinguished audience. Council of Europe is a final frontier to appeal for protection of human rights and the rule of law on the continent. So we hope to be heard and supported. The national anthem of our country starts with the words, "Ukraine has not yet perished." However, since 1993, the population of Ukraine decreased dramatically by 13%. The loss of population in our country after the collapse of the Soviet Union is comparable to results of World War II. Each year, hundreds of thousands of people die because of lack of medical care. According to the recently published CIA Factbook, Ukraine is in second place on the list of countries by true death rate, outrunning Chad, Guinea-Bissau, Central African Republic, Afghanistan, Somalia, Swaziland, and many others. So what is the reason? The explanation of our government currently comes down to the lack of funds. But is it true? According to the Constitution of Ukraine, the main social value in our country is life and health of Ukrainian citizens. However, the healthcare budget is only 78 euros per person, or just 3.2% of GDP, which is critically lower than the level we had in the Soviet Union, which was 8%, and recommended by Europe, 7%. So where is the state budget is allocated instead of access to treatment? Military costs. Ukraine spends about 2.5% of GDP on army instead of 1.4% in Germany and Denmark, 1.2% in Belgium and Sweden, 1% in Spain, 0.9% in Austria, 0.8% in Switzerland, 0.6% in Ireland. We have such disproportionate military budget in the country, which, thank God, didn't lead to any military conflict during the period of independence. We spend 1% of GDP on police, civil prosecution, and so on and so far. As a result, Ukraine is one of the few countries in the world, along with Lesotho and Zimbabwe, where life expectancy was lower in 2008 compared with 1960. On the other hand, contrary to the equality principle, Ukraine has a closed, high-quality healthcare enclave, exclusively serving the top-ranked governmental officials and politicians. The elitist healthcare unit receives about 1% from the Ukraine's total healthcare expenditures. It means that a small group of Ukrainian officials consumes the same amount of healthcare resources as 500,000 of Ukrainian citizens. What is this supposed to be, if not discrimination? So is life and health of Ukrainian citizens the main social value in our country? To answer this question, I would like to describe the situation with access to treatment of patients with hemophilia. As you probably know, the main strategy in the management of this disease is prevention of incapacitation due to bleedings caused by deficit of clotting factors. The primary indicator which is being used worldwide to assess a level of medical care to such category of patients is clotting factor units per capita. By this indicator, Ukraine demonstrates the worst result in Europe. The other issue is a healthcare management approach in this area. The government consciously limits the level of provided medical care because 7 reasons. For example, it's absolutely prohibited to receive home treatment. Preventive care is accessible only for children under the age of 6 and just in hospitals. There are significant delays in elective surgery. The National Hemophilia Patients Registry is not yet completed, and delivery of hemophilia care through the existing system of local treatment centers is ineffective, neither safe. Because there isn't any center certified by the European Hemophilia Safety Surveillance has in place. Because of the lack of access to adequate prophylaxis in Ukraine, 80% of children with hemophilia aged under 14 and 100% of hemophilia patients aged 18 have physical disabilities. All of them have physical disabilities instead of just 2% of such patients in Western Europe and the US. Only 32% of 2,672 hemophilia patients in Ukraine have a chance of reaching the age of 50. But the most pronounced example is situation with access to treatment for patients with hepatitis C. According to different epidemiological studies, there are from 3 to 8% of people infected with hepatitis C in Ukraine. Despite awareness on HCV is very low, 22,000 of patients diagnosed with HCV infection are currently waiting for immediate treatment. More than 10% of those patients won't be able to survive another year without treatment. Nevertheless, there isn't any agreement in the state budget to cover these costs. Taking into consideration the level of average salary in our country, which is about 300 euro, many HCV patients are forced to beg for money to pay for their treatment, or else accept their tragic fate. Because even if they shall not eat or not cover their basic needs, their year's salary will be only a small portion of the needed costs. The current healthcare budget, which is already called by the patient community as the budget of euthanasia, contradicts with Article 2 of the European Convention on Human Rights, because everyone's life shall be protected by law, and no one shall be deprived of his life intentionally. We also should not forget that failure to provide an access to medicine, as far as it is possible, is very difficult to assess differently than as inhuman and degrading treatment, which is also prohibited by the Article 3 of the above-mentioned European Convention on Human Rights. The described examples reflect the respect for human rights in Ukraine healthcare. We believe that the Subcommittee on Public Health will take into consideration the presented facts as well as those in comments of all Ukrainian Council for Patients' Rights and Safety to the national reports of Ukraine on implementation of Article 11 of European Social Charter. In order to win back the fundamental right in health, we really need your support. We kindly ask each of you to sign the written declaration regarding brutal violations of human rights in Ukrainian healthcare. We are not waiting for something exclusive from our government. We don't expect marble talents in our hospitals. But what we do expect is to have an opportunity to stay alive as far as it's possible. Thank you for your attention.
Mr. Secretary, thank you very much indeed for informing us on these matters. We have a motion inviting us to sign and give our support to your concerns. And in a moment, I would encourage colleagues to read this and to give your support by signing it. The paper is going to come round, which I think it would be very good if we collectively were able to do, to give Council of Europe support, and from this committee to the Council of Europe a paper which might help persuade the Ukrainian government to review its position on budget allocation at the moment, which is withdrawn from these areas of health need in your country. So we will address this. Meanwhile, thank you very much for your explanation.
Thank you very much.
Now, before we look at the paper I just referred to, I wonder if anybody from the floor would like to pick up any points which Mr. Marchetti has raised, or would like to hear any themes or concerns which relate to those. Now, it's the time to do that. Joe.
Just to ask, because the issue of haemophilia was raised, but does that apply to other health conditions as well? I'm assuming it does. I just wondered why you specifically highlighted and identified haemophilia.
Thank you very much for the question. The answer is very simple. As you probably know, you have our comments on the national report of Ukraine on implementation of Article 11 of European Social Charter. They have very limited time to prepare this document and to be very fair and transparent. That's why we've chosen 3 scenarios of access to medicine in Ukraine. The one is vaccination, where the main aim is to provide a coverage on 100%. And in Ukraine we have a budget to cover 100% of the needs. So we described this program on how the program with 100% of allocated costs is being provided in Ukraine. The second scenario was prepared to show how the medical need and the medical care is being provided partially. It's a case of haemophilia, because we have something and we don't have 100% result. And the third scenario is when no cent is being allocated in the state budget to cover the needed cost, the needed access to treatment. These 3 scenarios was presented to explain systematic problems of Ukrainian healthcare, systematic problems in respect for human rights in Ukraine,